Well, as a technologist, I've seen just about every element of our life being transformed. But when I first heard the term electronic health record a few years back, getting involved in the health game, it took me back to a time before smartphones, before laptops, even before desktop computers. The term electronic, I think, indicates kind of how old the problem is. I remember as a patient going into doctor's offices and seeing large walls full of paper folders. And of course, that needed to be solved. We needed to get away from analog paperwork and take the healthcare system at least into the 20th century. But to me, electronic health records take the healthcare system into the 20th century, but not the 21st. They're a solution to a problem. There's no doubt about that. We needed to get all those health records and data off of paper. But I think the term electronic indicates that this is more about machines than people. We really now need to turn our attention, having solved that paperwork problem, to getting the care back into what we now call digital health care. Electronic health records obviously will continue to be an important part of the system, but they don't keep people healthy. I've never seen a health record keep an individual healthy or make them feel better or make them change their behavior. We need to now put that problem in a sense behind this, and it's been expensive and long. Implementing electronic health records has been a big science project for so many organizations. But most of them are 90% or even 95% through that, and they need to turn their attention to patients now. What is it that's going to help make patients change their behavior and become healthier? We need to look toward patient-generated data. That's the really important stuff. And we need to get that now into a digital world shared by the patient and the patient's healthcare team, physicians, coaches, patient's family, and friends. Electronic health records will be in the background, just as every time we Google a term or do an electronic transaction on the web, there's a mainframe grinding away at large databases. But what's really going to be important to us now is that data that we collect, that we reflect on, and that we use to change our behavior.